First, I'd like to allow you all to introduce yourself so we can start off with Marcus Alston.
Hello, everyone. My name is Marcus Alston. I'm the founder and CEO of Alston for Athletes, where we're focused on providing free mental health care to student athletes struggling with mental health. Previously, I've done work with Mental Health America and MTV, and I currently serve on the board of directors for NAMI Maryland.
Hi everyone, I'm a junior at Cornell University. I'm currently a student ambassador with the JED Foundation, and I've done my own advocacy around creating a mental health guide on my campus and increasing awareness to young people on college campuses.
My name is Brianna Kennedy. I am a junior at the University of South Carolina-Aiken, studying molecular biology. Currently, I serve as the director of social media for the Yellow Tulip Project, and I'm a former Mental Health America youth mental health counselor leader. Most of my mental health advocacy is going to my local Boys and Girls Club to teach them the importance of mental health and self-care, and the importance of the importance of safe spaces as well.
Hi, everyone. My name is Sin. I use he and they pronouns. I'm a third year at UC Berkeley. I study social welfare with minors in race and the law and Spanish. Like Brianna and Marcus, we all have been a part of Mental Health America's Youth Leadership Council in previous years. And along with that, I am the Diversity, Equity, and Inclusion Director for a nonprofit called Tangible Movement. Currently, I'm a Rare Beauty, Rare Impact Ambassador. I really emphasize the importance of intersectional approaches to mental health, and excited to see where this conversation goes.
Glad to have you with us, Sin. I'll introduce myself. I am William Will McLean. I'm a rising sophomore at Stanford University. I was a previous summer intern for Philanthropy, and I also served on the Mental Health National Advisory Board, which was a cooperative effort between Active Minds, Wellbeing and Trust, and Young Invincibles. The first question I wanted to ask is just a basic foundational question. This is to all panelists. What brought you to the mental health space? And we can start with Katie first.
I think I have memories as young as like 4 or 5 experiencing anxiety, but my mental health really became more exacerbated like the more I progressed throughout school and middle school. Was when my social anxiety became really bad. And I guess throughout high school, these issues remained unaddressed around like anxiety, low self-esteem, perfectionism, and depression. Going into college, I eventually took a mental health leave, and that's when I truly finally got the care that I needed. And it's just empowered me to advocate more about the big transition that happens with young people when we go to college. There's usually a time when mental health conditions really worsen for young people, and there really needs to be more conversation about these challenges and learning to take care of our well-being and health on our own.
Brianna, what brought you to the mental health space?
Growing up Black in the South, I didn't really have a space to even acknowledge or to talk about my mental health. And that really was detrimental leading up to where I am now. Not having that safe space to talk about mental health really affected how I see things now. So most of my work is with youth to help with mental health spaces and to have these safe spaces so we can talk about them.
Sin, what brought you to the mental health space?
Yeah, similar to a lot of folks, I started struggling with my mental health when I was really young, my identity being a really prevalent component of that. Realizing that I was queer at a young age was really difficult to navigate in a community where it was predominantly Latina, and that context just wasn't there for me to understand what I was going through. Not to mention, I witnessed my family also struggling with mental health, and not really understanding that intergenerational struggles with mental health is another component of like the reality for a lot of like BIPOC communities or communities of color. And I wanted to make sure that, we were looking at mental health that acknowledges a full person and their full being. And like I mentioned before, acknowledges the intersectional identities and struggles and violence that we experience. And as someone who has struggled with self-harm, disordered eating, depression, anxiety, all of these things are compounding, but acknowledge that this is a part of my existence and a part of my work that remains consistent, regardless of the space that I come into.
And last but not least, Marcus, what brought you to the mental health space?
About 4 years ago, I was in a mental health crisis and I was in a very dark space. Throughout those times, I had a lot of introspection on my life and my life's experience being a biracial student athlete, struggling with mental health and, several surgeries and injuries. Like I said, through those dark times, it was just very clear to me that, my life's purpose is to help the next generation of student athletes through their mental health journeys. So I quit my corporate job September of 2019 to pursue advocacy full time.
Thank you, Marcus. But I wanted to ask you specifically, Brianna, growing up in the South and being a member of a BIPOC community, what do you see as primary mental health challenges that are affecting the youth of today?
So I work with specifically low income youth today, and it's a lot of intergenerational problems. Like my family didn't have the space to talk about mental health. They never had the comfort of getting resources for mental health. A lot of parents and teachers don't understand that there's a lot of pressures being young today in societal groups. There's a lot of pressures in schools. There's a lot of pressures at home. I remember when the Boys and Girls Club, one of the first things the director told me, like, they need stability in their life. They need to know someone cares about them and their mental health. And just small things like asking them about their day really makes a difference. Just listening to them and like hearing their problems and not invalidating them really truly influences them, impacts them, and it helps them kind of create a space where they know they're comfortable with talking about these issues.
I grew up in like a predominantly Latina and Asian American community, and being able to identify or really acknowledge the extent of the trauma that we're going through as young people is unlike any generation we've really seen before. We've seen monumental changes in mental health, and unfortunately not for the better. Depression, anxiety, PTSD, all of these very real diagnoses are skyrocketing amongst young people. When it comes to social media and the amount of violence we're able to witness on a daily basis as young people, COVID, gun violence, interpersonal violence, and the pressure that Brianna was talking about for young people to also bounce back from these very hard experiences that all of us have gone through. So knowledge is also really key, and knowing what you're experiencing.
What do you see as different about mental health for our generation that we're offered that's compared to the mental health that was offered to our parents and grandparents' generations?
I would definitely say stigma. Back then, my parents were born in the early 70s, and those conversations weren't happening. And I think now with all the panelists here, we have a bunch of great young advocates that are really trying to help change that narrative, where you're seeing, obviously there's still stigma, but that stigma is starting to decrease because of people like us.
Yeah, I definitely see social media as furthering comparison, and social media is exacerbating mental health issues. That, like, for me personally, when I was younger, I would go online, then come up with these ideas of like, oh, these people's lives are perfect, I'm not enough, and kind of compare myself, which furthered these patterns of depression and anxiety. And what's really helped me is having awareness about these patterns and being more proactive about which people I'm following, what content I want to see, and have made that a priority for my happiness and my well-being.
Social media can be a double-edged sword because it serves as like a community and like resilience building tool as well. During COVID, like that was our main mode of communication, our main way to bond and see one another. So although social media can really serve as these toxic or harmful or perpetuating cycles of harm, the ability to like coalesce and find community and support one another in a way that transcends like a physical space. Also, like identity-based experiences were able to be shared, where we were able to see like queer folks have online spaces together, or like brown folks or Black folks able to be in community with each other in a very different way. And yeah, I think those are a couple of the ways that I saw social media kind of transform the conversations we were having around mental health during COVID.
Another area of youth's lives that was really impacted by the COVID-19 pandemic was schools. Do you believe that schools provide enough support and resources for youth mental health?
I think schools could do a little better in terms of providing more mental health resources into like, here are some spaces that you can go to in order to maybe quell some anxiety. Here's some tips for mental health. Maybe we should take a little bit of time in class to kind of just sit and talk for a little bit. Students really need this support these days. And I feel like taking that initiative to focus is something that needs to happen.
I wanted to ask you, Marcus, what is that experience like for the resources that the university or the high school may offer to their student athletes?
The system, as we all know, is pretty overwhelmed right now. So, one sports psychologist might be responsible for, 100 or 150, student athletes. So I'm a big believer in equipping coaches and athletic administration with tools to help their student athletes. So, coaches are required to go through CPR training, but they don't go through any formal mental health training to be able to, help their athletes, or would be more inclined to talking and approaching their coaches about some of these challenges as opposed to, their family or their parents. So I'm a big believer in coaches going through some sort of formal mental health training.
Yeah, I was also like a high school athlete, and I just want to also acknowledge the cultural overhaul that needs to happen where these spaces prioritize single function. It's either to improve your physical skills or your performance in a sport, or ensure that you know the content of the course and you don't leave your mental health at the door when you come in to the classroom or walk onto the field or anything. And the culture of your peers and the professionals in the space needs to reflect the prioritization of mental health as well.
That's a great insight right there. You don't leave your mental health at the door when you walk into the classroom or you walk out onto the field. Katie, I wanted to ask you, what other places where you spend their time could it be activated to support youth mental health, such as online or in their community?
One idea I have is like on my campus, we don't really have a wellness center. If there like more of a wellness or like safe space around building a community and having like wellness resources, that might be a place where students feel safer speaking about what they're going through, especially if there's kind of more peer support, and having different student mental health orgs running it, or also having support from staff too. And also, like, since therapists are so burnt out, we really can't do like the preventative work for students. It kind of is like, how do we help these students in a crisis and kind of work them out of that? But it's like, how can we really have therapists helping like for students' long-term well-being, and not just being like a one-off that needs to be like consistent work and consistent resources and help that students are getting.
That's an age-old problem. There's more of a focus on putting a band-aid on individuals that are already hurt instead of identifying the root causes of what is going on and causing these mental breakdowns, these crises, these anxiety-inducing situations.
I think the importance in focusing on needing safe spaces to heal, because it's very detrimental to a lot of people, not just you, to have this kind of heavy pressure of not feeling comfortable to talk about mental health at all because of societal norms. I just think we as a society need to have more safe spaces to not only help smash the stigma of mental health, but to also heal from these traumas that we've already experienced.
I would just hope that we see mental health or like therapy and counseling being more accessible and equitable and affordable to all people. One of the gap is kind of cultural too, because a lot of young people know that they need help with their mental health, but it's like their parents have, because they're minors, their parents have to like sign off on them going to therapy, or they themselves have trauma that's unaddressed for them. For minors who have this awareness, how could we make counseling and therapy more accessible into the environments like the middle schools or the high schools, and having like the free counselor there?
And with that, I want to thank you all for all of the insight, the perspectives that you all provided from intersections across race and gender and communities. You all have really offered us as the audience the opportunity to better understand youth mental health in today's era and ways that we could continue to improve it. Thank you all so much.